Washington is in crisis right now, locked in a brutal government shutdown. And the central sticking point, it's not just general funding disagreements. It's a fight over $350 billion in healthcare handouts. Handouts that critics are warning pretty loudly are actually fueling massive market fraud and driving up costs for, frankly, every American who isn't getting one of these subsidies.
That really is the core of this standoff. We're talking about the Affordable Care Act's enhanced subsidies. You might have heard them called the Biden COVID credits.
Yeah.
They came in back in 2021, supposedly a temporary fix during the pandemic. But now, years later, the push is to make them permanent. That's the price being demanded to get the government back open.
Okay, let's dig into that because the conservative response, it's been pretty unified, pretty fierce. We heard Texas Representative Chip Roy put it very bluntly, the jig is up, the pandemic is over.
Yeah.
He argued Congress just cannot go wobbly on letting these temporary measures expire. The argument is that extending them is, well, a massive fiscal mistake. It rewards health insurance companies, and it fundamentally warps the entire healthcare market.
And that's exactly what we want to unpack in this deep dive. We're looking at the core conservative case for letting these subsidies expire as intended. We'll examine the evidence they're pointing to, the fiscal costs, the market distortion, which is significant, the fraud, which is surprisingly widespread according to reports, and then the market-driven reforms they're proposing as, a better path to affordability.
Right. Let's start with the money, because the numbers involved here are, well, they're the reason we're in this shutdown situation. These subsidies, they were always framed as temporary, a response to COVID-19. But as we often see happen, that temporary fix is now digging in its heels, demanding to become a huge, permanent burden on taxpayers.
And the price tag is just, well, it's stark. Extending these enhanced subsidies, it's estimated to cost taxpayers around $350 billion. And that's just over the next 5 years.
Just 5 years? Wow. Okay, you mentioned earlier this is a massive increase. How does that $350 billion compare to what we were already spending on the original ACA subsidies?
It pours gasoline on the fire, really. The existing cost of the original ACA subsidies, that was already projected to hit about $1 trillion over the next decade. A huge number itself. Now, if you tack on these extra COVID credits permanently, that total program cost balloons by an estimated 45%.
45% on top of $1 trillion.
Exactly. We're talking about adding hundreds of billions in debt tied to a program that, let's be honest, never had a reputation for fiscal stability to begin with.
Okay, this is where it gets really interesting, I think. Who's actually pushing hardest for this extension? Because that $350 billion, it doesn't go straight into consumers' pockets, does it?
No, it doesn't. It's paid directly to health insurers. And critics argue, quite forcefully, that the real beneficiaries here are these big insurance companies. They're the ones lobbying fiercely in Washington to keep these massive government payments flowing.
That seems like a perverse incentive, doesn't it?
It absolutely is. Representative Roy framed it pretty sharply. He argued that one side is effectively choosing to shut down the government because they want to funnel, by his math, about $450 billion to insurance companies. I mean, when the government is footing the bill like this, the pressure on insurers to actually control their prices, it just evaporates.
That makes sense. The taxpayer picks up the tab, so why lower the price? And that shifting of the burden, the lack of price control, that seems like the fundamental problem here. It leads directly into the next big area of concern, right? Market distortion and rising premiums.
Absolutely. It's a core economic argument against extending these subsidies. They distort the health insurance market, and key way they do that is by driving up premiums for everyone else, for people not getting the subsidy. Think about it. When the government heavily subsidizes the cost of something, sometimes making it free or nearly free for the end user.
The sellers raise their prices.
Exactly. The sellers, in this case the insurers, they know Uncle Sam will cover the difference. So prices go up.
So the policy meant to make healthcare cheaper actually gives provider, or insurers anyway, a green light to charge more. Is there data that actually confirms this is happening, this price inflation?
There is. We've seen specific market data pointing in this direction. A study from the Mercatus Center, for example, estimated that these enhanced subsidies correlated with a pretty significant premium spike, something like 15 to 20% in states that expanded Medicaid under the ACA.
15 to 20% higher premiums.
Yeah. And it's not just one study. The Congressional Budget Office, the CBO, they also confirmed that premiums for these exchange plans are rising faster than they originally anticipated. So if you're someone who doesn't qualify for the subsidy, you're the one paying that inflated price.
Okay, so beyond the purely financial cost and the market distortion, there are these really urgent questions about, well, program integrity, waste, fraud. Critics, like the Paragon Health Institute, they argue these enhanced subsidies basically fueled massive fraud. Why? Because they allow so many people to qualify for zero premium plans.
That zero premium aspect is key. Think about it from the consumer's perspective. If you don't get a monthly bill because your plan premium is zero.
You're much less likely to notice if something's wrong, like if you were enrolled without knowing, or if your information was used improperly.
Precisely. Experts argue this setup creates a huge incentive for unscrupulous brokers. Brokers get paid commissions for enrollments, right? So if they can sign people up, sometimes without their full knowledge or consent, into these heavily subsidized zero premium plans, the person might not notice for months. The government pays the premium, the broker gets paid, but the enrollment might be improper or even fraudulent.
It essentially removes the consumer as a watchdog on their own account.
That's a good way to put it. When you give health insurance away, essentially you lose that crucial layer of oversight.
The fraud statistics you mentioned are pretty shocking. Just how widespread is this problem of people improperly getting these subsidies?
Well, the CBO found that 2.3 million individuals improperly received premium tax credits, mainly by misstating their income.
2.3 million, that's a lot of people.
It is. But what's maybe even more concerning is the growth rate. That number jumped up from 1.3 million people just the year before, in 2023.
Wow, so it almost doubled in a year.
Nearly. An increase of about 1 million instances of improper payments in just 12 months. That strongly suggests that the program's integrity checks are just buckling under the weight of this, quote, temporary expansion.
Okay, that 2.3 million figure is undeniably massive. But let me play devil's advocate for a second. What's the counter argument? Is there a risk that if you tighten the verification rules too much,
You might prevent genuinely eligible people, maybe lower income folks who struggle with complex paperwork, from getting coverage they need?
exactly, that's the worry, isn't it?
It is, and that's the inherent policy tension you always face with means-tested programs. However, the argument from conservative policymakers is that the financial integrity of the system has to be paramount, especially when the numbers are this big. The specific fixes they're calling for are things like implementing strict upfront income verification rules before the subsidies flow, and also changing the subsidy structure itself to limit the availability of these zero premium plans that seem particularly vulnerable to fraud.
So the argument is basically if the system is hemorrhaging money through fraud and improper payments, any intended benefit is undermined anyway.
That's the crux of it, yes. You have to plug the leaks before you keep pouring money in.
Right. So if the goal is genuine long-term affordability, market stability, conservatives argue the focus needs a complete shift away from what they call endless federal handouts and towards fundamental market-based reform.
Exactly. The philosophy shifts to unleashing market forces and, crucially, empowering consumers. We've actually seen this approach reflected in some recent legislation that had success. For instance, remember the One Big Beautiful Bill, the OBBB? That package included some substantial conservative health reforms aimed precisely at restoring some sanity and integrity to the system.
Right, the OBBB. Remind us, what were the key changes in that package?
There were several important components. First, it included measures to tighten up eligibility reviews for both Medicaid and the ACA exchanges, directly targeting that improper enrollment and fraud issue we just discussed. Second, it introduced Medicaid work or community engagement requirements for able-bodied working-age adults without dependents, a controversial but key conservative policy priority. And third, very importantly, it expanded health savings accounts, HSAs. The idea there is to give consumers more skin in the game, tax advantages for saving for health care, and encourage more price-conscious decisions.
And the OBBB also included something called the Rural Health Transformation Program. That ties into market competition, doesn't it?
It does, yeah. The RHTP basically rewards states for adopting free market reforms. Specifically, it incentivizes them to get rid of anti-competitive certificate of need laws, often called Con-Ed laws.
Con-Ed laws.
Yeah.
Remind me what those do again.
Sure. Con laws are state regulations. They force hospitals or other medical facilities to get government permission before they can add new beds, buy major new equipment, or offer new services. Critics argue, and this is the conservative viewpoint, that these laws stifle competition, protect existing players, and ultimately drive up costs for patients. So the OBBB aims to encourage states to dismantle them.
Okay, so that was the OBBB, tightening eligibility, work requirements, HSAs, tackling con laws. Looking ahead now, beyond those immediate fixes, what are the next steps conservatives are pushing for in terms of market-based reform?
Well, the next policy agenda really doubles down on deregulation and transparency. Key items include allowing the sale of health insurance across state lines, the idea being to boost competition nationally, not just within state borders. Also, further expanding HSAs, making them more flexible and accessible. And a big one, mandating real, comprehensive hospital price transparency. So you, the patient, know the actual cost of a procedure before you get it, not weeks later in a surprise bill.
Knowledge is power for the consumer there.
Absolutely.
Now, for some conservatives, these reforms aren't enough. They believe the entire ACA structure needs to go, right? And there are proposals for a full replacement, like the one from the American Enterprise Institute, AEI. What does that look like?
Right, that's a more fundamental overhaul. That vision involves a full repeal of the ACA's current subsidy system, the one based on income. Instead of income-based subsidies paid to insurers, they propose replacing them with age-adjusted premium tax credits. These would be fixed, portable tax credits, meaning you could take them to buy any qualified plan you choose. The amount would increase as you get older, recognizing that healthcare costs tend to rise with age, and crucially, they'd be available to anyone not offered affordable coverage through an employer.
A fixed credit based on age, not income. That's a very different model. What do groups like AEI project would be the outcome of such a radical change?
Well, their projections are pretty striking. AEI estimated that this fixed credit approach could lead to 16 million more people having health insurance by 2025, compared to the baseline trajectory under the ACA.
More people insured. And what about the cost, the deficit impact?
That's perhaps the most dramatic projection. They calculated that the under 65 insurance provisions of their plan would actually create a $350 billion net budget surplus over 10 years.
A surplus from an insurance plan.
A $350 billion surplus. It's a massive shift from the current trajectory of generating hundreds of billions in new debt to actually saving money for the taxpayer while, they project, covering more people.
Okay, so let's try to wrap up this deep dive into this really high-stakes standoff. We're in a shutdown fight over extending temporary ACA subsidies that carry, what was it, a $350 billion price tag over just 5 years.
That's right. And critics argue this money isn't just costly, it's actively distorting the market. It leads to premium spikes estimated at 15 to 20% in some areas for people who don't get the subsidies.
And maybe most disturbingly, we looked at the CBO data showing 2.3 million individuals improperly received these credits by misstating income last year alone. That points to really deep flaws in the system's integrity, flaws that critics say primarily benefit the insurance companies getting the payments.
And the conservative counterproposal is clear. Stop extending these costly temporary handouts. Instead, the focus needs to be on urgent integrity fixes, like strict income verification up front. And beyond that, focus on fundamental patient empowerment through market-based reforms like the ones in the OBBB, expanding HSAs, promoting price transparency, and dismantling anti-competitive regulations like con laws.
So as policymakers demand an end to these escalating subsidies, the real question for you, the listener, is whether this temporary fix, now years past its supposed expiration date, is worth the long-term fiscal cost, the undeniable market distortion, and the really serious evidence of widespread waste and fraud.
And maybe here's a final provocative thought to leave you with. Even with those major cost-cutting reforms that were recently passed in the OBB, the eligibility checks, the work requirements, new CBO projections show something quite telling. They show that the baseline ACA subsidy spending, and this is excluding the extra COVID credits currently being debated, that baseline spending is still set to be $152 billion higher between 2026 and 2033 than what was projected just before all these recent spending increases began.
So even after tightening the belt, the underlying cost is still projected to be way higher than we thought just a few years ago.
$152 billion higher, which really raises the fundamental question. Are we truly addressing the root causes of why healthcare is so unaffordable in America? Or are we just treating the symptoms by constantly shifting more and more of the costs onto the taxpayer, propping up a system that might be fundamentally broken?